And I want to create FOMO. I think we need FOMO, What's your country doing versus what's our country doing? How are your nursing researchers doing? Let's do it. And so first of all, recognition as researchers. We just have to own that we are researchers. And so we have to own it as the individuals. I still, many even nurse and midwifery researchers now struggle to what their identity is. So I think there's an identity ownership for ourselves. We have to recognize us as rigorous researchers. I think for our organization, recognizing nursing and midwifery researchers is critical. So standalone recognition of those, regular communication about their achievements. And I think nurses and midwives, despite being the largest healthcare professional workforce, receive the least opportunities and the least recognition. So about how can we reward that? What does that look like? A clap didn't do it a few years ago, and a piece of paper is not going to do it for our fridge these days. Collaboration as partners. So if we think about hospitals or healthcare institutions and academia, they need to see us as equal partners across both of them. We're not being sold to the highest bidder. We are, trying to bring high quality evidence into clinical practice, so we can get capacity and capability. So that recommendation specifically came out from, in academia, you may have a 40-40-20 split of your role, where research is only 20% of your role. So how do we get more research time? And then, thinking about in our healthcare setting, I've got a few colleagues, and you may have as well, who have co-joint roles, or, the early clinician researchers and nurse researchers. How do they get time in practice? Because I think you're right, hospitals, they love us, they want us part of it, they have bought in and they can see the benefit, but still not releasing the time or giving us the capacity. And then capability, I believe nurses are really behind, and you can see that in many things. We haven't had the same training, and even when we come out of our PhD, we may not have run large scale multi-site clinical trials. So how do we pair nurse researchers up with, say, biostatisticians, health economists, AI specialists or data analysts? So